They have very effectively modeled for us challenging what we've heard today, reflecting on what we've heard today, and applying it to the work of the roundtables. Institute of Medicine roundtables, of course, are mechanisms that are dialogues, that are convened by sponsors. They don't come to solutions in the sense of making formal recommendations, so they're not hierarchical. They're unlike the Institute of Medicine consensus committees. One of the very biggest tools we have for influence is this dialogue itself. And I learned from Drew, our wizard on the web, that not only do we have more people looking at this than are in this auditorium today, or have over the course of the day, but we actually have more people looking at these asynchronously over time as they're archived on the web. So this dialogue is important in terms of being able to not only have what we've had, learn from what we've had presented about movements, but now for you, the members of the roundtable, to begin to reflect on those three questions publicly so that they can be captured not only for that audience as they view this conversation going forward, but it can also be captured in the formal summary that'll be produced of this discussion and therefore accessible to people over time. So with that thought about the Health Equity Roundtable having been underrepresented on this panel unintentionally because of last-minute circumstances, I wonder if I could invite a couple of members to go to the microphone and begin to start our reflective process. And I'd really like to see you do that. And I'm looking at, I have resorted in the past to having everybody identify themselves and have them going right up to the microphone, and I may well do that yet in the course of this, so don't be shy. Because you are smart people, you are leaders, and your reflections and views count and matter. So I'm hoping that you'll step to the microphone and make those reflections. Please identify yourself.
Octavio Martinez, Hawk Foundation for Mental Health, Health Equity Roundtable. Very compelling, obviously just like everyone else, and a lot of thoughts running through my mind. One of the ones, though, I wanted to start with was something that I found missing. It was mentioned maybe just in passing, but it really was also the use of technology and social media in reference to how a social movement is also advanced, because I know it's being used out there. I would have loved to have heard of maybe some examples, especially from the last panel maybe, since it was so interdisciplinary and so diverse. So I think that's an area for us as a roundtable, how maybe we can continue to facilitate having those kind of innovations come to the fore, because obviously I know that our young populations are very much in tune with today's technology, and so we want to be able to utilize it to its maximum for the great benefit of all. The other thing that struck me was really the whole issue of leadership. And for me, the one that kind of jumped out was Ron Heifetz's work in reference to technical versus adaptive type of leadership. And what I see here, what is really the challenge for us, we have a tendency to always slip back into the technical, but yet it's the adaptive where we really need to make the most progress in, because it's so challenging. And once again, I think when I'm thinking about the roundtable and what we can do to try to facilitate that is really to be a facilitator and make sure that it's being brought to the forefront. When you pose the question to us in reference, George, to what should the social movement include, so thinking about leadership, I'm thinking that, well, one thing would be that the Hawk Foundation has done in Texas. We created a leadership academy and called it a policy academy, but we took that academic model, but we put down the community, because we knew that that's where the capacity to happen with the advocates out there that are really trying to make the change, and they have the heart and they have the passion, but they didn't have exactly the skill sets. So helping them to be able, as a foundation, we could fund them to be able to get trained as such, and then they can go off and work on whatever it is that they need to work on, and what really grabs their passion, be it child adolescent. Our foundation is strictly mental health, so is it child and adolescent issues? Is it adult? Is it the severe mentally ill, or is it the, with our older population? But once again, it really then ties back into the technical versus adaptive, is helping that academy to make sure to help them to understand what are some of those policy levers and where they fall, and knowing that if we can move them into the adaptive realm of things, they will be actually much more successful of what they're trying to achieve. The other one is sort of tied to that, which is then thinking about the grass tops and grassroots. I'm also with the National Hispanic Council on Aging, and that's one of the approaches we've been taking there at that national organization, which is we're doing the policy work, which is at the grass tops level. But we've also been creating learning communities and actually instilling, I wouldn't say it's an academy, but it is a teaching of leadership skills to individuals at the grassroots level. So we go to Miami, we go to Dallas, we come here actually to Los Angeles, and we work with the community members that have self-identified, and this is just for elders. And they go, we want to do something about it in our community. And we bring them together and we actually take them through Academy and let them understand and how to actually maybe understand and write a quick little brief, how to go and meet with your community as well as state leaders to be able to make a difference and to have your voices heard. At the same time, the organization itself is tied into what's coming back from them and feeds in that knowledge to the grass tops leaders, who then we're working with the folks on the Hill within the Beltway to actually then sort of tie the two together. So those are just some thoughts that I had that I thought maybe would be quite interesting to look into.
Thank you so much for modeling not only a good reaction, but making some very important comments. I really appreciate that.
I'm Tony Villarreal, and I'm the chair of the Health Equity Roundtable. Lots of food for thought, and I think we've had some of this discussion even before coming to the meeting about health equity and what it means in this, what it means or what it's become, or, is health equity not sexy enough? Have people forgotten about disparities? Do they think it's all taken care of now because of the Affordable Care Act or because of the focus on social determinant? And so I think the message that I got here is what is it that we need to do to create the narrative in these fast-changing times around health equity and around health disparities. So I think we have to be more deliberate about keeping that front and center as part of the Affordable Care Act, as part of the many elements that go beyond getting people access to insurance. What does it mean for big data, for the different community partnerships that are going to be entailed here? What does it mean for health systems? What type of direction do they need as they're starting in this whole community engagement around health equity, and how can we work forward? Maybe it is an issue of shining the light on those that are making great movements in terms of health equity. So I think the big take home for me is, what is it about building the narrative? The focus on youth was really interesting because our next roundtable is going to be on youth. So I think this has given us some really good directions to think about how to involve, not just to involve youth, but what is the focus of what we want to be able to hear from them, that we can learn from them, to be able to engage them in the movement as well. Thanks.
Thank you so much. Who else from the Health Equity Roundtable would like to step to the microphone and make an observation? Ned, thank you. Who's going to be next after Ned? Please come on up to the microphone. Are there any other people from the Health Equity Roundtable here?
Oh, there are, and I'll point them out.
Please identify yourselves. Ned,
Ned
please.
Kalange with the Colorado Trust, and on the Health Equity Roundtable. Our name is much longer than that, which is really hard to get out in one phrase, but it's the promotion of health equity and elimination of health disparities. And I try to get better at it all the time. So, George, you know where I'm going to come from. It's going to have to do something with evidence generation. So when I was thinking about the movement issues, there's this point where you have to start proposing solutions. And I think that it would be useful for the Institute of Medicine and its infinite wisdom to start thinking about how to test solutions and develop an evidence base about what works in the social movement around health equity. There's a fascinating parallel to me right now going on at the NIH. So the new catchphrase is community engaged participatory research. And it's a little bit more than lip service, although I'm worried that's where it is right now, but it's starting to come with real dollars. And there are agencies whose budget is partially determined by the ability to engage patients in the research that's going to affect them, communities in the research that's going to affect them. And I think that's a really powerful movement. And it came on the heels of a recommendation from the Institute of Medicine. I think we need to be out there with recommendations that say we need to start funding activities and studies and evaluations and interventions that really look at addressing the social determinants of health and health disparities. If we don't take that on intentionally, then we'll have a dialogue, and we'll continue to have a dialogue, and we can have a dialogue without the Institute of Medicine. But it's the National Academy of Sciences, and I'd like to pull it back to the science and say, and make this plea for the IOM to think about what kind of recommendation, compelling recommendation around purposeful funding to look for solutions and innovations around what to me is the unacceptable part of healthcare in America today, the inequalities and inequities. I think that's a really important stand to take.
So I'd translate your suggestion, Ned, since roundtables can't directly make recommendations and so forth. But there is a history at the Institute of Medicine of various roundtables having dialogues and building the groundwork and the groundswell that have led to consensus studies that have made recommendations that have affected, and your example is a good one. So I think the task for your roundtable, and I'm not going to get the whole name at all. If you've had trouble, think about be in my position. But I think that the task then might be to go back to your roundtable and figure out what chain of events and what activities, that dialogue that you can sponsor and that engagement that we've learned so much about that's important today through many of the speakers, that engagement around this issue to build the support for leading to that sort of end. So I take your suggestion in that spirit. Phyllis.
Okay, well, I'm Phyllis Meadows, and probably very confused because I'm on both roundtables. But I first wanted to start by saying how much I really valued the presentations today. And like Tony, I think to have this sort of mixture of the theory as well as the practice was very, very important and very valuable. So I have a few comments. One is in response to your question about, what should this movement include? And I'll have to be very honest. I missed the decision point when we took on this brave endeavor of establishing a movement. And I'll say quite honestly, more after this presentation, I'm more on the fence about the roundtable establishing a movement than I was when I walked in to the meeting, for a lot of different reasons. One more important is we are not a community. And I mean that in the very broadest sense. While I think we all are committed to many of the same things, I don't think that we're organized as a community. And so I think as a first step, it would be important to try to build that sense of community within the roundtables themselves. I wanted to comment on something that Jeff said, and I really appreciated his comments. I think there are a lot of population health movements going on around the country, and I really resonated with that recommendation of really pulling those together and making some sense of those and sharing them. But I don't think that there are a lot of health equity movements underway. I think that they're sort of conflated, they're put together, and we were talking about this at lunch. We're finding safe words, we're finding safe activities. We're talking about fair. And then when I hear that as a person of color, I always say, well, who gets to decide what's fair? And, how do we work that into a movement? And so those are just sort of the kind of things that I'm struggling with. And I guess I think about all of the conversations I've heard. The frame for which many of the movements happen are local, sort of groundswell. And I just wonder if, as a roundtable, are we taking sort of mainstream privilege again by thinking that we can create this movement? Or should we be more responsive to the movements that are underway and figuring out a niche for our contribution to the movements that are already underway? So let's say we move on this train and we go forward with, we want to create a movement. And I know sometimes these things take on a whole activity on their own. But I would say, having worked in communities and worked with several new movements in my lifetime, that if we are going to take this on, my advice in response to your question is we better get help. We got to be clear about our capacity. Unless you're good at this, and the people we heard were profound leaders who've done tremendous work. This is not an easy thing. It's a nice, bold thing, but it's hard work. I think the research that we do is important. How can we take that and create a supportive role in movements rather than decide we want to take on the movement? And then the last thing, in response to your questions about if we're going to do this movement, I think it will be important for us, I think about this movement idea, and I sort of say, to what end? What really are we aiming for? More information about population health, more discourse about health equity, or are we really trying to change what we see our injustices around health in this country? Bold agenda for a movement, and I'm not sure we're ready to do that. But I think we are ready to begin to share some values and to share some priorities and really come to terms on what we do share as values and what we do think are priorities for this country. Thank you.
Thank you. Thank you very much. I would just add my own observation while the next person is going to the microphone from either of the roundtables at this point. So particularly the Population Health Roundtable, please come up to the microphones too. But I would add my own observation, Phyllis, that I think when we started thinking about this as a roundtable, at least in the Population Health Improvement Roundtable, we were a bit more confident that we could start one. And I think we've learned a lot in the process, at least I have learned a lot in the process. And I think this conversation today has gone a long way toward helping me understand some of the very important points you've just made. And you'll notice that the title of the workshop is Accelerating a Movement, even though we talked about creating one early on in the planning process. The planning committee itself evolved in its thinking, and I think quite appropriately so. And I think we have a lot to reflect on in terms of what we've heard today. And I'd like to see some more of you reflect on it with me. And so, right up there.
So, Judy Monroe, CDC, and member of the Population Roundtable. So I'll probably be repeating some of what I've heard because I really agree with so much of what's been said. I did walk away with humility from the presentations. I thought they were great, but I think it is humbling knowing that we can't do this alone. And that it resonated me. I think one of the speakers said something about the collective wisdom of the community, that's where the real wisdom is. So I think we have to mobilize that. Also, a little humbling to realize that we're David, not Goliath. But that creativity that David had, I thought that was a wonderful framing of that for us. And then I think what really resonated was this hardwiring for stories, and we've got to get the narrative right. So what does a movement look like if we were to help facilitate a movement and recognizing we can't do it alone? I heard that the media today sets the terms of the debate. And I think hearing, the grassroots, it's got to be a grassroots movement as well as from the top down. And if that's the case, I think we've got a lot of missed opportunity in our local communities with local media. Local radio. I was state health officer in Indiana, and I was always welcome at any of the small radio stations. We need to mobilize the talent, I believe, that's in our local community. So I like hearing some of what the other reactors have said about that. We've got to get into those communities to help mobilize those local champions and those folks that really would stand ready to take some of this on. I think we have to mobilize our youth as well as our older citizens. And I have a quick story. When I was health officer, I was invited to speak one evening about falls to a group of elders in a faith community. And it happened to be a snowy night, so when I arrived, I was hoping they'd cancel it, which they didn't, but luckily only a few people showed up. And when I was there, because it was a smaller group, we started storytelling. And I had them tell me if they had ever fallen, and it became a competition of who could tell the greatest story about how they had fallen. So I heard some terrific stories, but by the end of the evening, what had happened is they were so involved in this discussion and so excited that they begged me to give them an assignment. What could they do to help the state health department? What could they do to help advance population health? And they had networks, and they started outlining what they could do. So I think those are untapped around this area. I do agree with Jeff, though. Is it a population health movement or is it a health equity movement? So I think we need to think about that. And then in terms of filling the gap, I did hear today one of the speakers said that we really don't understand the internet, the use of the internet in movements. Maybe there are definitely research questions there. And I always wonder, do we need to package brief videos? Is that the way to reach people in the greatest way? Or do we really just need the sitcom or the movie that will help advance a movement? Thanks.
Excellent observations. We are right at that sort of juncture in time where social media and media are creating a revolution in the way we think. And I heard our opening speaker this morning talk about, at the very end of her presentation, pose that question, but not really address it. And so I think it's a potential follow-up for both of our roundtables, is how we can more effectively leverage social media, the internet, to learn and therefore be more effective in our missions as roundtables and in promoting health equity and reduction of disparities, as well as overall population health improvement. Please.
I'm Mary Lou Gakey with United Way in Santa Cruz County, California. I'm sorry California's so cold for you today. The question I want to answer is, what would the social movement look like? And the reason that's the one I want to address is that in community organizing, that's always the first and the most important question we ask people is, what would success look like for you? What's your hope? What's your aspiration? What would your healthy neighborhood or school or community look like? So now I'm going to tell you my hope and my aspiration. That the movement would be a success if, in every local community in America, young people, neighbors, civic organizations, faith communities would be gathered together, engaged with each other, setting their goals, their priorities, their strategies, with all the other sectors who want to live in healthy communities. They would be having skilled, professional, paid community organizers in strong, stable backbone organizations that will last. They would use evidence-based practices. They would be grounded in solid research, and they would have good success measures, and they would celebrate publicly their successes and critically analyze their failures. They would be linked to good, strong state and national organizations to magnify their policy work at all levels.
Thank you so much for that. Kathy?
Hi, this is Kathy. Is that working okay?
I can hear you. I hope the people on the web can.
I got it. Yeah. I got an idea.
There you go.
Okay. All right. So on these questions, this has been quite a fascinating day, and I've gone through an oscillation between feeling like there's a tremendous sense of urgency and the time is now and we really have to act, to, wow, this is unbelievably complicated and we better spend another 2 years thinking about it and deliberating, and I'm not sure we'll be able to figure it out. And or we need advisors or something. And so there's been this gamut from one end of this continuum to the other, and I kind of found myself going back and forth. But, you know, to be pragmatic, I came down on this position that we do have a sense of urgency, and there is a confluence of factors which bring us to the point that doing something now, and whether that's exactly what we originally envisioned as a movement or it's accelerating a movement or something like that, that there is an appropriate action to take. And if we go back to our first two speakers today, they were really giving us hints and almost calling on us to say, you folks here on this roundtable at the IOM, or these two roundtables, do have an opportunity to do something meaningful. And I went back to the statement, which is the importance of a transformational vision, which brings together criticality and hope. And I think part of our responsibility is to bring that together clearly. But we've said to ourselves all year in the Population Health Roundtable that we've got to get out from speaking just to ourselves. And maybe if we're not creating and owning the movement, but maybe facilitating it, that part of our role is helping to take the position and the credibility and the authority that we have as collective individuals and as this roundtable group, and help to get that transformational vision out to other parties in an effective way, so that we are together being those catalysts of the movement. And you know, I agree with the fact that there's a lot going on. We've heard that there's, you know, maybe thousands of groups, there's people organizing everywhere, and there's people doing things. But the big question I have is, well, so is it really the answer? What's going on today? Do we believe that it's going to solve the problems that we've been talking about? And if we do nothing, is the do nothing strategy the best course of action, because there's all kinds of people out there doing all kinds of things already? And I don't think so, because it's like saying today there's thousands of people out there doing health stuff, so that therefore we must be able to get our health outcomes met. And we're not. You know, we're in a state of sort of miserable performance. So just because people are doing stuff doesn't mean that we're on the right path. So how can we improve the efficacy of what's going on already? How can we maybe use our position to bring in the grass tops while the grassroots are going? You know, I think there's a place where we can do that. And on this question of population health versus health equity, kind of, you know, if we just do one, I think they're both really important. And getting to health equity will help us to get population health. But when we look at the understanding of all of the social determinants, that's a pretty big platform to be considering about how we achieve that. So I think our role is more in facilitation and potentially, but it's definitely there.
Thank you, Kathy. And I'm always impressed with how much I learn from my fellow roundtable members and how much I'm learning from the members of the Health Equity Roundtable. Forgive me for not going with a long name. And in particular, I wonder if the particular question that's stimulated, you know, by your comments, Kathy, is more appropriately for our two roundtables. How can we be an effective participant in the larger movements that promote health equity and population health as Institute of Medicine roundtables, as opposed to being so self-centered or egotistical to think that we're starting it or moving it and so forth. But perhaps that's more the question. I think whoever is in that bright light that I can't see who it is that you, Winston?
Yes, me,
yeah,
Winston.
Okay, and then I'm going to go over here to you and then back here. Winston?
Thank you. And thank you, George, for, as always, being an excellent facilitator to bring our opinions and ideas forward for the good of the commons. So I wanted to certainly agree with Phyllis earlier where she said we're really not the folks who are organizing the social movement. This is not, believe it or not, this is not the first Congress of the social movement for health equity or population health. What the IOM does, and I specifically I think around the roundtable, it helps illuminate issues that we need to be sharing with the American public so that all the stakeholders become more informed around what the direction is in front of us, at least to add some clarity to the discussion. So I was thinking really one thing that hadn't been talked about so much today was really where we are in terms of 21st century health and medicine. And interestingly, I think I only heard maybe one comment around health data and health or gathering metrics at the population level. And it is really a point where we're hitting an inflection point, where every day now, I don't think I'm being exaggerating that we're literally accumulating trillions of bits of information about people who are seeking health care, who have various conditions, et cetera. It's an inflection point that's reflected in the fact that we even use these terms, population health, or we use these terms, health equity, which probably would have been totally foreign in a discussion just 20 years ago, because we did not have an understanding of what data in aggregate in terms of social need, social health, could be described appropriately. Now, having said that, at this inflection point of where we are at the crest of really doing some potentially amazing things, I think what we need to do as a roundtable, as roundtables, is to warn that using this kind of information in an ignorant way, or in a way that's certainly not cognizant of the power to achieve health equity or improve health for all Americans, is really quite a potential outcome, and something that we need to be illuminating and supporting with regards to not making that happen, where all this information becomes the property of individuals who just use it to incur better profit margins or better revenue sources of identifying ways that they can self-survive. So what do we need to do as a roundtable? I think we need to advocate, or at least point out, that transparency of this information is really key. It's transparency, and I think one of our community organizers said, transparency of data for communities to use and for people to understand. And this touches a little bit around the roundtable on health literacy, where health literacy and what we know about aggregate social health needs to be at the hands of people who can work upon it and make it into a social movement. Along that line is when we talk about population health and we talk about data that aggregate social health, we must talk about health equity. And I have said before, ultimately, when we look at the success of our ability to achieve population health, that metric ultimately is distilled down in terms of how we achieve health equity. That has to be a core issue of what we would say in terms of what the IOM helps illuminate all the stakeholders that are engaged in this discussion around not only building social movements, but how we achieve a better health for Americans.
Thank you very much, Winston. Now that we're getting the conversation going, we're going to have to focus our comments. Okay, over here, this side.
Hi, I'm going to try to dovetail on what Winston said a little bit. My name is Melissa Simon. I'm from Northwestern. I'm also a member of the Roundtable on Health Equity. And I've spent the last couple of years prior to this working with Institute of Medicine as an anniversary fellow. So I really gained, working on a variety of projects, gained a great and deep respect for everybody there, but also appreciation for the power of the IOM to be a convener and a conveyor of important information. I mean, people quote the IOM all the time, all kinds of people. And building on what Ms. Arguello said from Physicians for Social Responsibility, she uses that information. She really asked us to, like Winston said, to digest the information so that people building these movements, this groundswell, can use it effectively. But what I've seen in these roundtables is amazing work. There's discussion papers that come out of this, of your roundtable, especially on population improvement, that are really amazing. And all of these workshops have information that is, mind-boggling in so many different ways and very educational. But what I haven't seen in the IOM is very little products and things that actually speak directly to the people who are doing the movements on the ground.
I haven't seen very many narratives that are coming from the people doing movements on the ground as the majority of a workshop as opposed to the minority of a workshop. I haven't seen their narratives be discussion papers without the academics, the academic mode of it. Like what we should be thinking about as well as how we make those products that are more useful to the people on the ground doing this work to help bolster it. You know, we can help bolster academia and grant applications and manuscripts, et cetera, but how can we really effectively bolster the information that we have and the knowledge to really help bolster the people on the ground doing this? So maybe a workshop should be about narrative around one particular social determinant, and then have people who are actually doing the work on the ground be the majority of that workshop delivery. And then have discussion papers from the people who are doing the work on the ground as opposed to the academics and the more senior people in the field. Just a thought.
That's a great comment, and I think that contemplating how we can use better stories and narrative, I think, is just a terrific comment. And just for the people listening on the web, the roundtables will meet after this meeting and really have in-depth conversations about how we can follow up. And so really appreciate that comment. I cannot see who's up there because of this light, but please make your comment. Identify yourself, make your comment.
Terry Wright, the American Public Health Association. First, and I'm glad I'm following. I'm sorry, a member of the, thank you, a member of the Roundtable on the Promotion of Health Equity and the Elimination of Health Disparities. And I'm almost going to duplicate what the young lady before me said with a couple of additional pieces to it. First, though, I want to thank the Planning Committee for today's set of panelists and speakers. I think they were phenomenal. They provided skills as well as ideas, and also, I think, stimulated some critical thought, which I think is one of the advantages of these workshops. So I want to extend my appreciation for the thought that the Planning Committee put into convening these panelists today. It was excellent. Thank you very much. Secondly, I want to follow up on a comment Jeff made and take it one step further, and maybe we should consider walking the talk and consider a coalition of these two roundtables and make this be the start, since we are heading in, I think, a common vision, in the direction of a common vision. Maybe there's some value to a coalition of these two roundtables. He said it a little bit differently. I'm taking it a little bit further than what he said. And I'm going to leave it at that, just like he did. And then I'd like to also follow up on a couple things Phyllis said, and then lead right back to what, I'm sorry, what's your name? Melissa, thank you, what Melissa said. So I have seen a number of different movements around, small movements around the country going on in the direction of population health and or equity. And I'm of the thinking that population health and academic achievement contributes to equity, not health equity, equity. And so I don't think we should qualify it, but I live with the qualifier of health equity, just to be accepting. But I do think population health plus academic achievement, as Duran, no, it wasn't Duran, it was the young lady from Meta, thank you, spoke about academic achievement, because if you look at we all know graduates of high school have a different life than those who drop out from high school. So academic achievement is absolutely a part of health and well-being as an adult. So if we put them together, we can probably achieve equity, hopefully in my lifetime. And then I wanted to talk about what Melissa said, and that I think one of the things we did here repeatedly, and I've seen it also in action, is the utilization of documents and publications that come out of the National Academy of Sciences. So maybe what we could do is find out from some of these movement leaders what information would be helpful to them. By convening them, I recall one of our roundtable workshops that we did, I think in St. Louis. Karen's going to have to help me remember, when we had the room was packed. Really? The St. Louis one? Who was with Rose then? Okay. Where we had, the room was packed. The auditorium was packed with community organizations who spoke about the work that they were doing to eliminate, at that time, health disparities. I wonder if we asked them what they could use, what would be helpful in terms of information, in terms of documents, publications, etc., and then use that as our work agenda to create those documents collectively between the two roundtables that they then can use as they, because we are only talking about accelerating the movement. We're not talking about being the movement. And so how can we accelerate? Asking them what would be useful to the two people who spoke from the two different organizations to advance their movement. Since NAS has the credibility, and we have the credibility, they have the power. They have the people on the ground. How can we be helpful? How can we be your agents in order to accelerate the movement? Maybe that's something that can be very concrete and very helpful to people. And I won't be here tomorrow, so I'm putting my 2 cents in right now because unfortunately I won't be able to participate tomorrow. So how can we be helpful going forward in terms of achieving equity?
Thank you for your 2 cents. Now, let me ask how many people still want to make comments, because we've got 2 concluding comments we're going to need that I want to get to from Mildred and from David. We've got a little less than about 15 minutes, so we're going to have to budget ourselves a little bit. So if I could have a couple, we've got 1 there.
Okay.
And we've got, how many over here? 3? 3?
One
couple?
member and 2 people who aren't members of
Okay, and Martha, did you raise your hand? I did. Okay, go get up to the microphone, I'll get you in there. Okay, now let's get ourselves, let's budget ourselves and be very economical in our comments. Can
Okay.
we do that? Okay, and I'm going to go right over here for you to model that for us.
George Flores, California Endowment and Population Health Roundtable. It's ironic that tomorrow and the next day, meeting just 20 miles away, is a group of 1,000 promotoras de salud, health promoters, community health workers under the name of Visión y Compromiso here in Los Angeles. They're from all over the western United States. And I guarantee you, because I've been at their conferences before, they're talking about why isn't the power structure giving us more respect for what we do. We're working on equity. We're working on population health. That's what we do. That there probably are the majority of people in that room, 1,000 people, the majority of them are not even paid for what they do. And the ones that are paid do it many, many more hours than what they're paid for, and they're at the bottom of the pay scale. And they ask not only why doesn't the power structure respect us more, but why don't they spend the money that they do spend more wisely? Because they're having us do one piece at a time. They tell us that we can only talk about breastfeeding, or we can only talk about signing up for a health program when we know these families have so much more need, and we could give them so much more service if we had the time and the authorization and the information to do that. So these are some of the answers to the questions you're asking as to the other people. Why aren't there the resources? Why isn't there the smart money being spent? Why isn't there the authorization? Because there are people there that want to do this work, and they're from the communities. They live in those communities. If we could only create the means by which to mobilize, to support, and I think that word support is the key one here, with resources, with authorization, the people that are there willing to work in the communities that we need these aims achieved, I think will have gone far. And the IOM has a lot of means at its disposal to do that.
Great, thank you, George. I could tell a story about a visit that I had this week to the United Way in Santa Fe around early childhood development, but I won't because of the time. It would illustrate your point there. Right up here.
Jose Montero from New Hampshire. Amazing day, a little bit of a time capsule going back to when I was young, handsome, and had more hair. where I was still working in Colombia, where we did a lot of community engagement and participation using methodologies that were specifically geared for that. And when I got started, I made a big mistake to think that I knew what I was doing, and came to tell them how to improve the communities and learn that that's not the way that that works. And it's good that we are realizing that we are not going to make the same mistake here. We are not creating a movement. We are funneling the movement and giving some visibility in areas where maybe it didn't have it. I was listening to the presentation this morning. We have the political opportunity that was created from the health side by the ACA. Wherever we are in each one of our states in the implementation, it is creating a dialogue that we didn't have, and we need to take on that moment. In several states, it has happened already, as we have heard over the last several meetings of this Population Health Roundtable, in which I am a member. We can facilitate the creation or the visibility of those structures that allow wider mobilization, and clearly we can provide a place where this resonates better. I was looking at the data that we didn't discuss in the mission in San Francisco. What are their outcomes? Well, they want to improve the credit to 640. We keep saying, from the health side, we know that a better income, you have better health. How do we tie these things? How do we bring them together to show where the social determinants of health are? I have never, in all my years in public health practice, tied credit worthiness with health outcomes. But as we look at this from a different perspective, maybe that is where we need to go and create here the space for that to happen. We cannot make it just an academic pursuit. We need answers soon. And that's something that we need to clarify, is what our outcome and for when. As a roundtable, what do we want to achieve? To write a couple of papers, to funnel the movement, to create the visibility, and by when? By when are we going to have the improvement in the health outcomes? And I know that we have the drivers, and we'll be discussing that tomorrow. But that's maybe a place where we need to go as this discussion moves forward. Listening to today, when I came to the Population Health Roundtable, I saw this a perfect place for the discussion of how do we redistribute or realign what we spend in healthcare. But looking at the discussion today in health equities is the other half of what, what's his name, Anthony presented this afternoon. How do we tackle the social determinants? So we have clearly here two different missions that are quite complementary. How do we tie them together? Going down the road is really important for us. And another comment, looking at the issue about do we need somebody that we need to fight with? I come from the government, so sometimes I am used to be the one that you fight with. And the reality is that we are on the same side of the table, and we just change roles every other day. We do a lot of advocacy. We funnel money to a lot of advocates. And then the advocates come and think that we are the bad guy. And some days we are, but not always. Not always. So how do we get to that understanding and see that we don't necessarily, I think what was Jeff, who used a really interesting constructive antagonism, because our roles switch all the time. Sometimes we from the government are arguing with a nonprofit, sometimes the nonprofit is arguing with us, sometimes we are supporting the community against private business, but some other days we are with the private business trying to change what the community is trying to do. Our roles interchange. So looking for a permanent demon or dragon that we're going to fight with may not be constructive. How do we help to facilitate that discussion here and identify that our roles switch by the time of the day? And that's an important thing that we need to realize all the time. And we cannot forget that regardless of where we sit, we are still members of a community, users of health services, and have families who are in the same position. So we don't do this for them, the communities. We do this for us, because we are part of that community. And we need to stop talking in such an abstract term as the other, because we are part of that same community as a provider, as a user, as a payer.
Well, language counts, language matters. I love your comment about the relationship to creditworthiness and health. Martha.
David's been standing longer than I have.
Go ahead. Okay. Martha, you're next.
Okay.
I've got a lot of thoughts, but I'll try and be very brief and not too disorganized. I guess I have wonders, questions about whether the idea of forging this as a health equity movement is a sort of starter in terms of language. And I guess because of some of the things we've heard, the cautionary tales from the other side of the aisle, you know, equity is not something that everybody can necessarily unite over. People can unite over perhaps equality of opportunity. So there's some verbiage things that I think that need to be straight. I did come in here sort of thinking, gee, if we were going to do something as a round table or round tables, we would probably do many different things because we come from different parts of communities, and that we would be talking out of, you know, talking to different people based on our sort of credibility in those communities. I leave here thinking more that, you know, we really need to join the things that are going on and give them more oomph by saying, and you get health too. And use the power of our professions and our, you know, our good credibility to sort of buttress that. I do think a couple of cautionary things. I think it'd be lovely if we could sort of drum up lots of evidence to shore things up, but I do want to say that the experience of the last consensus committee that I sat on about public health strategies, I think the evidence base here is just not as hot as we'd like it to be, and so to position ourselves to look for things that we think are going to be necessarily make the case may be challenging. But the other thing that I'm aware of is that a lot of people in the United States are just not aware enough of the inequalities that exist in health, and that we need to be better in getting the message across. However, having said all that, what was resonant to me was, you know, Tony's presentation saying things are this way because of history, right? And we, you know, history tends to propel itself forward. I'm struck by when Shorter Lives, Poorer Health came out. The New York Times had a short article on it, but we couldn't seem to galvanize enough interest to get op-eds going across the media. What are we going to do in terms of heightening this? When the administration talks about ACA giving health opportunities for everyone, what we need to be able to do is to get to the administration and talk to them about very different ways to get the message across about health and to remove it from the medical care perspective. So those are my thoughts.
Yeah, good comments. Martha, I think one thing I've learned today is that movements don't just happen. People just don't all of a sudden turn into, you know, participants. That there needs to be structure and intent and resources. And so to answer your last questions about, you know, that report and the New York Times, that stuff needs to be planned for. It needs to be engineered in a sense by people who have intent. You know, it needs to be thoughtful, intentful. And I think for some of us that could be a role that we play by stimulating the dialogue about what needs to happen. I'm just reflecting on your own comment, but you know, every time something like an event like that occurs at the National Academy that has such salience as that report that you referred to, the follow-up needs to be planned. And we'll probably need to be more intentful and reflective about how to get that done. So my personal comment on your comment. You want to make an additional comment? No, okay. Drew, do we have something from the web?
Yep.
And
yes,
before I go with that, I'm aware that there are probably a few people in this audience from the general public. If you would like to make a comment, I will take it after I take this comment from the web. Drew?
Okay, this is from Pamela Russo, member of the Roundtable on Population Health Improvement. The papers by Merlin and Marshall and the presentation by Francesca gave us an important grounding and showed us that there have been many more movements in the last century than I was at least aware of. We need to attend to their recommendations around the questions, and we need to address in order to consider the goals of such a movement.
Thank you very much, Pamela. And Pamela's been just a terrific leader and participant in our roundtable. So we've got two over here, and I'm going to take those two. And while we're doing that, David and Margaret, why don't you come up and get ready to make some concluding remarks, please.
Okay, I'm Christine Backrack, and I don't consider myself totally general public, but I'm not a member of the roundtables. I'm one of the authors of one of the background documents on the field of population health research, and I've been here to try to think about how to better articulate that field with a possible movement in population health, and more specifically in population health action. I do tend to think that there's a sort of a we versus them kind of dynamic around research and action sometimes, and it may be that it is mostly lodged in the academic side of things rather than in the action side of things. But one of the things I'd really like the roundtable to do is to think hard and long about how research can be more effectively supportive of bringing the field of population health to maturity, to being accepted as the way that we take care of our nation's health. I'm wondering whether we need new models of research, perhaps something like community-based participatory research, but then perhaps other models as well that go along with action as action is produced and produce knowledge out of that action, so that there's a mutual back and forth. I think that I really like to see the IOM and the roundtable think about how to legitimize new models of research within academia so that people feel freer to pursue that kind of endeavor without risking their tenure. So those are my thoughts. Thank you.
Thank you so much. Right up here.
I'm Champagne Fanchan. I also consider myself the people from the public. I was here 2 weeks ago for the Health Literacy Roundtable, and I'm very happy.
Welcome back.
I knocked off the mic last time, and today I'll be careful. And I'm very happy IOM had the roundtable here in the Southland, so we local people can really be a part of it. It's really a very enjoyable pleasure day to really experience what new knowledge can bring excitement and provocative thinking. And based on the movement that I have learned, many movements have focusing on physical health, nutrition, and environment, access to care, and some of the safety and also opportunities to thrive. That's how, from my limited perspective. So I was really thinking, would IOM be able to take a really tangible action to define population health in an action-based bullet point, sort of coming up with a model of action that these action can equip everyone of the citizen in U.S. and people in U.S. to move closer to the vision of population health. What exactly is population health? And also, I never once hear the word wellness in the whole discussion today. And there are a lot of wellness movement out there, but how they define wellness are basically very much the physical part of a person, food and physical activity. How about CDC's Healthy Brand? And those are wonderful apps the elders or maybe other people could do to sharpen their mind. And lots of people today talked about how through the movement, the grassroots movements, they generate the context that people feel connected. They feel connected and empowered so their voice can be heard at a higher level in their governments, and so that they can make an impact on their policy making. And to me, that's really create a higher level of connection that is so much needed for the mental health of every individual. So is it possible that IOM will be able to take action to define the vision of population health in an actionable manner, and that everyone can do it, and we are going beyond medical model, which is problem-based. We know health is inequality, so we are saying we need to do health quality and health equity. and to eliminate health disparity. So that's, to me, is very medical model. Can we really paint the picture? Thank you.
Thank you for that comment, and thank you for the challenge to be able to reach out to the public, and thank you for the challenge to be aware not too much of being a medical model framework. I really appreciate that comment. So thank you for these terrific comments. It's my task now to turn the conversation back to Mildred Thompson. I apologize for misidentifying you. And then to David Kindig for concluding remarks. And it's been a pleasure for me to be here and to be part of this learning, and I look forward to their comments.
Thank you.
Thank you.
Okay.